Hi, so today I would like to demonstrate what I consider to be the primary function of an X-ray technologist working within surgery, and that is reproducibility. If you're doing fixation devices, you really have to provide the exact same image every time you come back to an angle so that the physician can truly assess the correction that they're making or the permanent fixation. So this example here, I have a foam block which has washers laid out in a certain star configuration, and I have a BB on the underside. So what I would like to try and show you is placing the BB inside those washers every time I go back and forth. So our first image here, that would be our true AP or PA, whichever. So this is our first image. So to make sure that I can maintain that each time, with a pencil, I will then go ahead and mark my boom arm. So that gives me my in and out. And then I also place a pencil mark on the C component. Now, if you're doing orthopedic cases, this part of the C-arm is usually exposed because the blue orthopedic sterile drape is on the front. So you can get full access to marking up the C. So that would be my AP. Now I'm going to do my oblique, or one of the obliques. So for that, I'm going to come back towards me. And let's go ahead and place that BB. So you can see we're pretty close there, but I have to move the C-arm in just a touch. And a little bit more. So not only that, but I'm also looking to keep my object within a relative center of the screen. So from here, I will now go ahead and make a second mark to indicate that that is my oblique. So let's say this is pelvis, that would be my iliac oblique. And then I'll demonstrate my over the top or obturator oblique. Again, if we're looking at pelvis. So if we go ahead and roll over, and then we'll take an image to see what we have there. So we need to bring that back across the screen. So we'll bring the C-arm back towards me. There we go, we're getting close. So let's go ahead and accept that one. So again, I mark my C. I go ahead and place my mark on the boom arm so I know what my in and outs will be. So it might take a few exposures to key in your angles and your views, but once you have them, it then allows you for much more efficient imaging. So now I will go back to my AP. So the first thing I do is I have to correct back my C, and then I would place my in and out back to my mark, so picture. And you can see the BB is placed directly in the washer. If I had to go back to my obturator oblique, I would apply my rollover and then come back to my marked position, picture. Again, BB is placed inside the washer. Now if we want to go back and see that iliac oblique, I'll come back to my marked position. I'll push in until I find the mark I had on my boom. And again, you have a BB demonstrated there. So to go back and forth between those, so from one oblique all the way over to the next, we'll go ahead and sweep on up. And picture. Again, BB's there. Let's come ahead and back. Again, the washer is displayed. And finally back on up to the AP. So again, of those 6 or 7 exposures, they're all useful because the BB is placed exactly within the washer, and that level of reproducibility with the efficiency is beneficial for absolutely everyone, and that will make your life a whole lot easier in those tough cases.